Ever had your body do something totally bizarre, like seeing squiggly lines in your vision or getting a brain freeze from ice cream? Our bodies are complex machines, and these odd sensations are usually just signs that everything's working as it should. From eye twitches to pins and needles, we all experience these quirks. But have you ever wondered they happen? Today, we're diving into the science behind 8 of the weirdest, most common body hitches. By the end, you'll understand what's happening inside you, and maybe even appreciate how wonderfully strange your body really is. Let's get started. Let's start with those drifting specks and mysterious shapes that seem to float across your vision, especially when you're staring at a bright, clear sky or a blank wall. You might notice them as little squiggles, dots, or cobweb-like threads. These are what we call eye floaters. Despite how real they look, these aren't dust particles on your eye's surface or tiny bugs flying around. Instead, they're actually tiny clumps of protein or collagen fibers suspended inside the gel-like substance that fills your eyeball, called the vitreous humor. As we get older, the vitreous humor slowly becomes more liquid and less gel-like. This change causes the collagen fibers inside to stick together and form little clumps or strands, which then cast shadows on your retina, the light-sensitive layer at the back of your eye. That's what you're actually seeing move around, especially when you shift your gaze or look at something bright. The floaters drift as your eyes move, and sometimes seem to dart away when you try to look at them directly. For most people, floaters are completely harmless and just a normal part of the aging process. They're a sign that your eyes are changing, but not necessarily in a bad way. Over time, your brain gets really good at ignoring them, so you might stop noticing them altogether unless you're really looking for them. However, if you suddenly notice a big increase in floaters, see flashes of light, or experience a shadow or curtain over part of your vision, it's important to see an eye doctor right away. These could be signs of a retinal tear or detachment, which needs immediate attention. But for most of us, floaters are just a quirky, harmless reminder of the fascinating things happening inside our eyes every day. Almost everyone will experience them at some point, and most of the time, they're nothing to stress about. So next time you spot a squiggle or a drifting dot, just remember, it's your biology in action, a little window into the inner workings of your eyes. Chances are, your brain will soon filter them out and you'll forget they're even there. But always stay alert for sudden changes in your vision. Floaters may be weird, but they're usually nothing to worry about, so keep an eye out. Pun absolutely intended. Floaters are just another fascinating part of being human. Now, let's move on to the next body mystery and see what else your amazing body has in store. Brain freeze, scientifically known as sphenopalatine ganglioneuralgia, is that sudden stabbing pain you get when you eat or drink something cold a little too quickly. It's a sensation most of us have experienced, especially on a hot day when we can't resist devouring ice cream or sipping an icy drink. The pain is so intense and surprising that it can stop you in your tracks, making you wince or even laugh at how dramatic it feels. But despite the name, your brain isn't actually freezing. What's really happening is a reaction in the roof of your mouth, where sensitive nerves are located just beneath the surface. When something cold hits your palate, it rapidly cools the blood vessels in that area, causing them to constrict almost instantly. This sudden change is what sets off the chain reaction. Your body, always trying to maintain balance, overcompensates by quickly dilating those same blood vessels. This rapid expansion triggers pain signals that travel along the trigeminal nerve, which is responsible for sensations in your face and head. That's why the pain shoots up to your forehead, making it feel like your whole head is under attack. The result? A headache that feels like it's coming from deep inside your skull, even though the real culprit is your mouth. To make the pain go away faster, try pressing your tongue firmly against the roof of your mouth or sipping something warm. This helps bring the temperature in your mouth back to normal, easing the discomfort. Of course, the best way to avoid brain freeze is to eat cold foods slowly and give your mouth time to adjust. Savor each bite, and you'll not only dodge the pain but also enjoy your treat even more. Believe it or not, brain freeze is actually your body's way of protecting your brain from sudden temperature changes. It's a clever, if uncomfortable, defense mechanism, even if it feels like a cruel joke in the moment. So next time you're tempted to wolf down that ice cream, remember, slowing down means more enjoyment and less pain. Your taste buds and your forehead will thank you. Brain freeze is just one fascinating example of your body's protective reflexes at work. It's a reminder that sometimes patience really does pay off. So next time, enjoy your treat mindfully and let your body do its job. Now let's move on and explore another odd and intriguing sensation your body can produce. Are you ready to discover the science behind that creepy crawly feeling? Let's dive in. Ever felt like bugs were crawling on your skin, but nothing's there? That's called formication. It's a type of tactile hallucination, often triggered by stress, anxiety, or nerve misfires. When your nervous system is on high alert, it can misinterpret normal signals, like a hair moving or a temperature change, as something crawling. Other causes include hormonal changes, dehydration, or certain medications. Sometimes, it's linked to nerve conditions or skin issues, but most of the time, it's harmless and temporary. Managing stress, staying hydrated, and getting enough rest can help. If it's persistent or severe, talk to a doctor. For most of us, it's just another example of the mind-body connection. Your brain can play tricks on your senses. Let's move on to another itch you can't ignore. Have you ever noticed that your nose always seems to itch at the most inconvenient moments, right in the middle of a meeting, or when you're trying to stay still? It's a universal experience, and the culprit behind this annoying sensation is something called histamine. Deep inside your nose, there's a whole army of immune cells on constant alert. When they sense invaders like pollen, dust, or even pet dander, they release histamine, a chemical that's part of your body's natural defense system. Histamine's job is to help flush out these irritants, but it also has a side effect. It stimulates the nerve endings in your nose, making you feel that irresistible urge to scratch. The nose is packed with these sensitive nerves, which is why even a tiny trigger can set off a big itch. But allergies aren't the only reason your nose might itch. Sometimes your nerves can misfire for no clear reason at all, sending random itch signals even when there's nothing to fight off. When you scratch, you actually create a mild pain signal that temporarily distracts your brain from the itch. Unfortunately, this relief doesn't last long. Scratching can irritate the skin and make the itch return even stronger, trapping you in a frustrating cycle. Environmental factors play a role too. Dry air from heaters or air conditioning can dry out the delicate membranes inside your nose, making them more prone to itching and discomfort. So, whether you're indoors or outdoors, your nose itch could be caused by your immune system, your nerves, or simply the environment around you. It's a complex mix of biology and surroundings. If your nose is constantly itchy and you notice other symptoms like sneezing or watery eyes, it might be time to try an over-the-counter antihistamine to calm things down. For occasional itches, a gentle touch or a dab of moisturizer can soothe dry skin and help you resist the urge to scratch. That little itch is a small but mighty reminder of just how sensitive and responsive your body really is, always working to protect you, even if it's a bit annoying sometimes. Coming up next, ever wondered why motion can make you feel queasy? Let's dive into the science behind motion sickness. Motion sickness is your brain's response to mixed signals from your eyes, inner ears, and body. Your inner ear senses movement, but if your eyes see something still, like the inside of a car, your brain gets confused. This sensory mismatch triggers nausea, dizziness, and cold sweats. Evolutionarily, your brain may interpret this as poisoning, so it tries to purge your stomach. Some people are more prone: kids, pregnant women, migraine sufferers. To prevent it, sync your senses. Look at the horizon. Sit where motion is less intense, and avoid heavy meals. Medications like antihistamines can help. Motion sickness is your ancient survival instincts misfiring in modern life. It's unpleasant, but usually harmless. Next time you travel, try these tricks. Now, let's talk about those sudden, painful leg cramps. Ready? Ever been jolted awake by a leg cramp? That's a Charlie horse, a sudden, intense muscle spasm. The exact cause isn't fully known, but muscle fatigue, nerve overexcitability, dehydration, and electrolyte imbalances are big factors. Overexertion, not drinking enough water, or sleeping with your feet pointed down can all trigger cramps. When a cramp hits, gently stretch the muscle. Pull your toes toward your shin for calf cramps. Heat can help relax the muscle afterward. To prevent cramps, stay hydrated, eat foods rich in potassium and magnesium, and stretch before bed. Most cramps are harmless, though painful. If they're frequent or severe, check with your doctor. Your body's signals aren't always subtle. Let's move to another twitchy topic: eyelid spasms. Ever had your eye pulse for no reason? Here's why. 13. That fluttery eyelid twitch? It's called myokemia, an involuntary spasm of the eyelid muscle. The main triggers stress, lack of sleep, and too much caffeine. These factors make your nerves more excitable, and the delicate eyelid muscles are often the first to react. Eye strain and dry eyes can also contribute. Most twitches are harmless and go away on their own. To stop them, reduce stress, get more sleep, cut back on caffeine, and use artificial tears if needed. If the twitch spreads, lasts weeks, or affects other facial muscles, see a doctor. For most of us, it's just a sign to slow down and rest. Even tiny muscles can signal when your body needs a break. Now let's talk about an itch few discuss but many experience. Let's talk about why the groin area gets itchy. Yes, it's common and totally normal. The groin is warm, moist, and covered in skin folds, making it a perfect environment for sweat, friction, and microbes. Sweat and trapped moisture can irritate sensitive skin and encourage fungal growth. Think jock itch. Tight clothing and synthetic fabrics make it worse by trapping heat and increasing friction. Allergies to soaps, detergents, or fabrics can also cause itching. The solution: keep the area clean, dry, and cool. Use mild soap, dry thoroughly, and wear loose, breathable cotton underwear. If the itch persists, try an antifungal cream. Most of the time, it's just biology, not a mystery. Understanding the cause makes it easier to manage. Don't be embarrassed, it's a common issue with simple solutions. Now let's wrap up our weird body tour. That's a wrap on 8 of the body's weirdest quirks. Understanding these odd sensations makes them less alarming and more fascinating. Next time your body acts up, remember, it's just your biology at work. What's the weirdest thing your body does? Share in the comments. If you enjoyed this, give us a thumbs up and subscribe for more science. Thanks for watching. See you next time.